Hey, it's Monday, January 8th. So what's going on? Last week, Walgreens announced that they're cutting their dividend in half to just 25 cents a share. Ooh. Motor Trend has named the Prius the car of the year for 2024 with its 150 horsepower engine and 0 to 60 in just 7.2 seconds. Our Chicago Bears, yes, they did us proud, right? No, they didn't. I watched that game, and that's time I'll never, ever get back in my life. They lost 17-9, and I can tell you this, from my perspective, the coach did nothing to endear himself to Chicago fans to be invited back. And what else is going on? Oh, last night, the Golden Globes, Oppenheimer, the movie, it won 5 Golden Globes. So good for them. I own that movie. I can't wait to watch it now. Hey, so this week we're going to take a look at Blue Cross Blue Shield, the Medicare Advantage Flex program. With the Flex program, you know what? This changes everything about Medicare Advantage plans. And that's a pretty bold statement, isn't it? So why does it change everything? Well, for one thing is, you see Crazy Joe and Crazy JJ advertising 0 premium, 0 copay for everything, right? This has a $202 a month premium. So yes, for $202, boy, this policy really stands up and really delivers. It has a 0 deductible. It has a 0 copay. It has preventative care. Well, everybody's got preventative care. You haven't told us anything new yet. I know I haven't told you anything new, but it's got a 0 out of pocket, in and out of network, in and out of network. Maybe I could figure out a little meme to that. But a 0 out of pocket, in and out of network. And it has 0 for emergency care. I'm going to read it off my list right here. Urgent care, diagnostic services, skilled nursing facilities, physical therapy, ambulances, and a whole lot more. It also has built into it the prescription drug plan, so it covers your Part D requirements. So why would somebody want to go out and spend $202 a month when, you know, you can turn your TV on in the middle of your morning gun smoke or Gilligan's Island rerun? You can see these advertising these celebrities for all these 0 premium, 0 copay, and you get all this and the other thing. Well, here's some reasons why somebody might want to buy this Medicare Advantage Flex program. It's the person who wants to pay a premium and not have to worry about claims, plain and simple. That's like a Medicare supplement. In fact, these plans are designed to replace a Medicare Plan G or a Plan F. You want to go to their preferred pharmacy, you have to make sure that you go to the pharmacy in the network there. On this one, you've looked at your prescriptions and the formulary works for you. With anything you have to do that, but a lot of times people just buy what they say on TV and don't care. Other things are you have to live within the approved counties in Illinois, and there's a whole lot of approved counties in Illinois. The question is more who's not been approved in Illinois. Let's see. Another person who would be a good candidate for this would be somebody who's already spending $202 a month more for their drug program and their Medicare supplement combined. So this is a way of getting those benefits essentially at a lower cost. So Mark, but I'm concerned about this network. They always say I have to stay in network. Well, yes, Blue Cross does have a network. But what if you go to a doctor out of network? This still is going to apply the same way. The provider could then charge you and you could be reimbursed by the insurance company, or the provider could just bill the insurance company directly. The biggest thing to note with any type of Medicare supplement policy is applicable here. When you present your ID card, if the provider doesn't take Medicare, the provider has to tell you that up front, or the provider is by default agreeing to what the insurance company is willing to pay for the Medicare Advantage plan. That's the way it's supposed to work. And so far I haven't had any complaints on it, and this is now going into its 3rd policy year, and like I say, this policy changes everything. So Mark, what's going on at the MLD agency? Well, Last week we picked up a new client. We also sold a couple of dental policies, working on 2 groups for their renewals for their group health insurance. And for those of you who are with prescription drug plans or Medicare Advantage plans where the premium's being paid by Social Security, which is deducting it from your Social Security check, Social Security as yet doesn't seem like they've paid those premiums. Not to worry, they're saying that they're going to pay them by the end of the month, and the insurance companies are verifying that. So I guess all is good. Until next week, please take care. I think we're supposed to have some snow, and it's supposed to get a little cold, so stay warm and safe.